Good morning. I'm Commander Dennis Spence, and I'm the Chair of Research Education and Facilitation at the Naval Medical Center, San Diego, California. In this podcast, I will talk about how to write an abstract. The objectives for this podcast include to describe types of titles used for abstracts in research manuscripts, to discuss how to write an abstract, and to review examples of structured and unstructured abstracts. We'll talk about some general submission guidelines, and I will list the chain of command clearance process for publications here at Naval Medical Center San Diego. Similar processes are also in place at other military institutions. So what are the types of titles? Two kinds of titles that are typically reported in abstracts, research manuscripts, and even case reports. Here's an example of an indicative title: a multi-drug regimen for treatment of metastatic breast cancer. This title might also have a subtitle which states a cooperative group trial comparing X drug with Y drug. Another type of title is an informative title, and using the same example, it can be written as such: a new multi-drug regimen for treatment of metastatic breast cancer produces greater survival than X drug. You can see in the informative title it gives a little bit more information to the reader about what is going to be presented in the abstract or in the research report. Both titles are appropriate, and you need to consider the journal that you're submitting your abstract to and what they tend to prefer. The best way to find this out is to review many of their published articles or abstracts. There's two types of abstract submissions. Many times you're going to submit an abstract to a research conference or proceedings, and other times you're going to submit an abstract as part of a research report or a case report that you're submitting to a professional journal. Typically at conferences, they will have a call for abstracts based on their research interests. And how well that abstract is written will determine whether or not it is accepted for an oral presentation or a poster presentation. Additionally, abstracts can also be written in a structured form or an unstructured form. In some following slides, I will go into greater detail about this. So what are abstracts? Well, they serve as a miniaturized study report. And they're a lot easier to write if the study is done. Especially when you're submitting an abstract to a conference and you want to get selected for an oral presentation, you have a higher likelihood of getting selected if your study is complete. However, if you still want to present results in a poster format and the study's not done, many times you can indicate that in the results or conclusions section of the abstract, and reviewers can consider, based on the relevance of the topic that you investigated, whether or not it's worthy of selection for their conference. Reviewers and readers are going to accept or reject your abstract based on how well it's written, how relevant it is to what their interests are. So it's really important that you take the time and put forth the effort to put out a good product. So what are the components of structured abstract? Just like a research report, they fall into the four categories: introduction, methods, results, and conclusion. In a research report or manuscript, typically the order is usually presented as an introduction, a methods, results, a discussion, and a conclusion. However, in an abstract, you typically don't have enough space to present a header for discussion and conclusion. However, this may vary from journal to journal, and you need to see what their guidelines for authors recommend. The introduction section answers the so what question. It's typically only written in 1 to 2 sentences, and it's a brief description of the problem, background, and purpose or objective of the report or the research study. It should be written in plain English, and you should really avoid jargon run-on sentences, and the use of abbreviations or acronyms whenever possible. Many times when you're submitting an abstract to a conference proceeding, you may have a panel of reviewers that are going to score your abstract, and depending on how high it's scored will determine whether or not it's accepted or rejected for presentation, or maybe accepted for an oral presentation or a poster presentation. If it's hard to read, or there's too many abbreviations or acronyms, what's going to happen is it's going to make it harder on the reader or the reviewer, and there's less likelihood that it may get selected, or in the case of an abstract submitted as part of a research manuscript that's accepted for publication, the reader may not choose to read the full manuscript. The methods section describes the study design. It also lists the population sampled and the sample size. If this is a randomized controlled trial or an intervention study, you may need to briefly describe the intervention that you used, any data collection methods. Also, I like to present what my primary aim, and if I have space, what my secondary aims are. The results section reports the main findings of the study. You need to be thorough but brief. You don't have a lot of space when you're writing an abstract. In some journals or for some conferences proceedings, it may be less than 250 words. So you need to really get to the point. The results section is the most important part of an abstract. You need to state key results in words, followed by numbers. And here's some examples. This was taken out of a study I found on PubMed. And this example reads, patients treated with drug X were twice as likely to require dialysis as compared to those treated with the Y drug. And in parentheses, the authors listed the differences in proportions. In this case, it was 20% versus 11%. And then they went on to list the relative risk and the 95% confidence interval. Another example from a results section was this, where they reported fewer seizures, and in the parentheses they actually presented the results for their outcomes. Notice how the results are presented briefly and they get to the point fairly quickly. Ideally, you should use confidence intervals and p-values to establish the precision and statistical significance of your results. The conclusion section is really answers the question, what do the results mean? You need to be specific, and you do not want to reword the results or make superfluous declarations. You need to make a reasonable statement about what the implications mean and what are the relevance to the audience that you're publishing this abstract to. This is really important because reviewers or readers may choose to read or select your abstract for presentation based on how well or how closely relevant your results are to what their interests are. Also, if you have space, you should discuss whether or not future research is needed, and if so, you should state what sort of study might be done. For example, maybe you did an observational study or a case control study looking at a certain outcome, and you found some interesting results. In your conclusion, you might say that in the future, randomized controlled trials may be needed to compare X intervention's effectiveness on Y outcome. An unstructured abstract is written in a similar format to a structured abstract, with the exception that it does not have the headings that are typically listed in a structured abstract. In the first few sentences, you're going to describe your research question and study design aim. Then in the next couple sentences, you're going to list your main results, close with a major conclusion and or implications and the relevance of your findings. When writing an abstract for a case report, there's a similar format, and typically you're going to follow the format of how you write the case report. In some journals, the amount of space you have may be limited to less than 250 words. However, you need to review the guidelines for authors to find the specific details of what the journal or the conference proceedings expect. As I mentioned, it follows the order of the case report, and you need to succinctly describe the 4 sections: the introduction, the case summary, the discussion, and the conclusion. Another way that you can write an abstract for a case report is to present maybe an interesting clinical problem that was the focus of the case report, and to present a couple lines from your discussion that are important that highlight this case, and then maybe end with the purpose of the case report. Here's an example of a published abstract from a research study that we recently conducted that was published in the American Association of Nurses and Anesthetists. In this study, you can see we used an indicative title with a subtitle. So in this case, the title was Perioperative Administration of Gabapentin for Shoulder Arthroscopy, a prospective, randomized, double-blind, placebo-controlled study. And this is our introduction section to the abstract. As you can see in the first line, recent studies suggest gabapentin has opioid-sparing effects and may reduce acute postoperative pain. In this sentence, we get really quickly to the point and tell the reader that we're probably going to talk about gabapentin and how it has opioid-sparing effects. And then we have a transition sentence or a statement that indicates the problem that we're going to investigate. And as you can see here, we wrote, however, there is limited research on the efficacy of gabapentin when combined in a multimodal approach. In the methods section, we list the research design, a prospective double-blind study, the sample size, 70 subjects, and we state that they were randomized, and we listed what our intervention was. In this case, either 300 milligrams of gabapentin or placebo 1 hour prior to surgery, and then twice a day for 2 days. And then we concluded the methods section with our primary outcome, which was average pain scores. And because we had space, we listed what our secondary outcomes were. In our results section, we got right to what our primary aim was, that there was no significant differences in pain scores on day 1 and day 2. And in parentheses, we presented the mean and standard deviation with the p-values. If we had space, we could have also presented the 95% confidence intervals. Similarly, we presented our secondary aims, which was total morphine consumption equivalence on day 1 and day 2. We also listed some of our side effects because we had additional space. And then in our conclusion statement, we basically stated what we found and indicated what it means. So in this case, we stated that this dosing regimen was not efficacious in improving outcomes in patients undergoing shoulder arthroscopy under general anesthesia with an interscaling block. If we had more space, we might have indicated what further research may have been needed. Here's an example of a case report abstract. And this was published in the American Association of Nurses and Anesthetists. And you can see using an indicative title. And in this example, it's severe preeclampsia, pulmonary edema, and peripartum cardiomyopathy in a prima gravida patient. So this tells the reader right off the bat that this case report is probably going to talk about preeclampsia, pulmonary edema, and cardiomyopathy in a pregnant patient. And you can see here, we first talk about how peripartum cardiomyopathy is a rare form of heart failure. And then we talk about a little bit of background on what that disease pathology is, and a little bit of how it's diagnosed and managed. And then we actually conclude this abstract with what the purpose of this case report is. In this case, our purpose was to describe the presentation and anesthetic management of a parturient who was admitted with a diagnosis of severe preeclampsia, who subsequently was diagnosed with peripartum cardiomyopathy at pregnancy. So here's some general tips that will help you when you're writing an abstract. You need to follow the instructions exactly. If you're submitting an abstract to a conference, or the abstract is part of a manuscript you're submitting to a journal, you need to read the guidelines for authors and follow them exactly. Also, deadlines are deadlines. If you're submitting an abstract for a conference proceeding and it's due on October 31st, but you try and submit it on November 1st, many times the reviewers are not going to accept your abstract. If you're submitting an abstract to a conference and you're asking for it to be considered for an oral or a poster presentation, with many people viewing an oral presentation as a much higher prestigious type of presentation, it's really important how you write the abstract. Similarly, it's just as important of how well you write the abstract, even if you want to present it for a poster presentation. Typically what's going to happen is your abstract is going to be reviewed by one or more reviewers, typically 2, maybe 3, and its selection may be solely based on how well that abstract is written. So you need to really take time and put forth the effort to put out the best product possible. The relevance and how well the abstract is written is going to determine whether or not it's accepted or rejected. As I mentioned, it may help determine whether or not you're going to get an oral or a poster presentation. If the abstract is part of a manuscript that you're submitting for publication and it gets published, readers that are going through PubMed and they come across your abstract are going to decide whether or not they want to read the whole manuscript based on how relevant the content in your abstract is to their practice and how well written it is. So take the time to write a good abstract. So why are abstracts rejected for conference proceedings? It does not address an important issue. So you need to really look at what the call for abstracts and what they're looking for in the specific categories and see if you can sell your research in that category. Maybe the research design in question are not clear, or the design and methodology are inappropriate for the purpose of research question. Maybe your sample size is too small, your findings are not clear, your conclusions are not logical or not supported by the results, and the implications or relevance are not addressed. And finally, and probably one of the more important aspects, is that if an abstract is poorly written, then it's no matter how well the study was conducted, if it's poorly written, the reviewers aren't going to select the abstract because they can't figure out what you're trying to say. Here's a checklist that can help you when preparing an abstract for publication. In terms of the title, you need to answer these questions. Are the title and research question closely related? Does the title perk interest? This is important because reviewers, if you can capture their attention, they may be more likely to read your abstract in greater detail. Are there any special features of the study mentioned in the title? In terms of writing the abstract, you need to make sure that there's an introduction, a methods, results, and a conclusion section. Also, if there's other headers or parts that need to go into the abstract, you need to make sure that that information is included in the abstract. Some conferences, such as nursing, may ask for the theoretical or conceptual framework, and you need to describe it in that section. You need to make sure that key features and results are mentioned, and that the conclusions follow the results, and that you follow the submission rules. If you're active duty in the military, or you work at a military institution as a civilian or contractor, you need to make sure that you follow the chain of command clearance policy. And you should not submit until you have approval from your chain of command. This means you don't submit your abstract until you get the final approval letter from your chain of command. And for officers in the military, there's been a recent policy change on chain of command clearance. If you're going to include a publication on your fitness report, many times your chain of command is going to ask as part of your brag sheet to include a copy of the chain of command clearance form as verification that you actually followed the policy. And if you don't have that information, they may not let you include that bullet in your fitness report. So you need to complete, at Naval Medical Center San Diego, there's an electronic version of the chain of command clearance form, and typically the process is fairly quick. usually within a couple of weeks, unless it's something that's controversial, involves any of the combat theaters of operation, in which case you may need BUMED clearance. So here at Naval Medical Center San Diego, you route the chain of command clearance form electronically through your chain of command. And it obviously starts with you, then it goes to your department head, your director, then it goes to the medical editor, and then to the public affairs officer who reviews it, and then if everything looks good, they return it back to the author. Once you get that approval back, then you're okay to submit your abstract to the conference. You need to, when preparing for an abstract for publication, you need to make a timeline and anticipate how long it's going to take to write the abstract, to edit it and revise it, and to get it through the chain of command. I always tell people who are writing or submitting something to a conference, you need to add at least 2 weeks to a month to make sure that you get all those steps completed. Finally, I list here the NavMed Center instruction 5600.2 Kappa, which is the chain of command clearance instruction. And finally, you must include a disclaimer on any publication. And this is the disclaimer listed here. Thank you.